Welcome back to Pharmacy News. 28% of Australians are currently living with obesity, and joining me now to discuss this healthcare crisis is Dr. Gary Kilov. Thank you for your time, Doctor.
Most welcome.
Tell me, what do you think is the leading cause of obesity in Australia?
As you've pointed out, a significant proportion of adult Australians are living with obesity. And the primary driver of this, I guess, is that we live in an obesogenic environment. What I mean by that is that our environment is very, very different from what it was during the period of human evolution, when we were driven to be physically active, to seek food. It's time of food insecurity,
Yes.
time of feast, but also famine. And so our bodies were remarkably well adapted to cope with periods of deficit of food. We now live in a situation where to be physically active, you actually have to go out and deliberately seek physical activity. Our jobs are often sedentary, and as far as food is concerned, it is ubiquitous, it is available, it is tasty, it is affordable. And so those mechanisms that maintained the balance in the past have now been replaced by excess.
So is it a simple case of diet and exercise?
That's a very interesting question, and you may recall back in the 80s we had the Life Be In It program.
Yes.
And during that time, that's what we told people to do. Of course, it's been spectacularly unsuccessful. Since that time, our understanding of the drivers of obesity have increased significantly. So we have a much more sophisticated and in-depth knowledge of the drivers, which are biochemical, which are psychological, which are environmental. So obesity is complex. And whilst a healthy lifestyle underpins the management of obesity, as it does for any chronic disease, it is only the start of the process. Now, if individuals are able to achieve the weight loss that they desire by modifying lifestyle, that's great. But many people will not achieve that. And therapies will need to be intensified, they will need to be escalated. That may mean that pharmacotherapy is involved, or even surgery. But I think the key thing here is to recognise that obesity is a chronic disease, and it needs to be managed as we would other chronic diseases.
So how can doctors and pharmacists manage this crisis?
I think firstly by recognising this as a chronic, progressive condition. In other words, short-term treatment for a long-term condition makes no sense at all.
Sure.
Treatment needs to be in perpetuity. And as I mentioned, if you are not achieving your stated goals, you need to intensify the therapy. You need to review the results, you need to review the outcomes, and if you're not achieving what you set out to achieve, you need a different treatment or an additional treatment.
Of course.
Now, as I mentioned, obesity is complex, and so it requires a multidisciplinary involvement. Pharmacists and GPs work very well with patients. They get to understand their patients, they get to build up long-term relationships, and this is core to accompanying the patient on their journey to manage the condition. So we will ask patients for permission to engage them and involve them in management. We will assist them, we will refer them if necessary, we will prescribe medications or dispense medications if that's necessary. So it's really about being part of a much broader team to progress the treatment over the long term.
Speaking of long term, say 10 years' time, where do you think the obesity crisis will be? Will it be a crisis?
If things don't change, if we look at the current trajectory, in 10 years' time we are likely to go from the current 28%, as you said, to 33%. In other words,
Really?
1 in 3 adults will be obese. This is a crisis, as you quite correctly said. This is not overstating it, because obesity is accompanied by a whole range of other comorbidities. Obesity does not like to travel alone. It likes company, and that company is diabetes, cardiovascular disease, elevated blood pressure, arthritis, and even cancer. Many people don't appreciate that obesity significantly increases certain types of cancer.
Doctor, thank you so much for your time. We could sit and chat for ages. I really appreciate it. I hope you enjoy APP 2016.
You're very welcome. Thank you for inviting me along.
We'll be back with more pharmacy news shortly.